Can vitamin B12 actually cause acne? And if it does, what should you do about it? Vitamin B12 is genuinely important for your health. It supports neurological function, helps your body form red blood cells, and plays a role in DNA synthesis. So when people notice breakouts after starting B12 supplements or injections, it's understandably confusing and a little worrying. Here's what the current evidence tells us. High-dose B12 supplementation can trigger acne in some people, but not everyone. Most people taking B12 will not experience this at all. The key word is susceptible. So how might it happen? Research suggests that elevated B12 levels in the body can alter the behaviour of a bacterium that naturally lives on your skin called Cutibacterium acnes. It appears to change how those bacteria express certain genes, leading to increased production of compounds called porphyrins. And those porphyrins can promote inflammation inside the hair follicle, which is what leads to spots. High-dose B12, particularly intramuscular injections, appears most strongly linked to this effect. Dietary intake from foods like meat, fish, and dairy appears to carry a much lower risk compared with high-dose supplements or injections. It's also worth knowing that if breakouts do occur, they tend to appear within the first 1 to 4 weeks of starting B12 therapy, so that timing can be a useful clue. If you have a personal history of acne, you may be more susceptible, so it's worth keeping a close eye on your skin in those early weeks. Now, here's the really important part. If you're taking B12 because you have a diagnosed deficiency, please do not stop taking it without speaking to your doctor first. Untreated B12 deficiency can cause serious harm, including neurological damage and anemia. Any skin concern needs to be weighed carefully against those risks, and that's a conversation to have with a healthcare professional. What you can discuss with your doctor is whether your current dose is still necessary, particularly if your deficiency has been corrected. They may also suggest topical treatments to manage any breakouts without interrupting your B12 therapy. First-line options in the UK, in line with NICE guidance, include combinations like adapalene with benzoyl peroxide or benzoyl peroxide with clindamycin. For more persistent acne, a doctor might consider oral antibiotics, though these aren't suitable for everyone, and your clinician will advise what's appropriate for you. In severe cases involving scarring, a referral to a dermatologist may be appropriate. If you suspect your B12 is causing a skin reaction, you can report it through the MHRA Yellow Card scheme. That's the UK's system for flagging suspected side effects from medicines and supplements. There's a link in the description. To recap, vitamin B12 can trigger acne in some people, particularly at high doses, by affecting skin bacteria behaviour. But this is relatively uncommon. Never stop prescribed B12 treatment without medical guidance, because the risks of untreated deficiency are serious, and there are effective options for managing breakouts without having to choose between your skin and your health. This video is for general information only and doesn't replace advice from your GP, pharmacist, or dermatologist. Always check with a healthcare professional before making any changes to your treatment. Have you ever noticed a skin change after starting a new supplement? Let us know in the comments. If you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more evidence-based health content.